Diseases of the urinary system can interfere with our elimination of soluble wastes. Diseases of the reproductive system can interfere with the ability to reproduce offspring. In the urinary system, there is the kidney, the ureter, the bladder, and the urethra. And you will remember that the female urethra is shorter than the male urethra. The female reproductive system is composed of the vagina, the uterus, and the fallopian tubes. The cervix, which is the opening to the uterus, has a mucus plug that prevents material from getting into the uterus except during ovulation. The fallopian tubes open directly into the peritoneal cavity. The ovaries, the other organ of the female reproductive system, are in the peritoneal cavity but not directly attached to the fallopian tubes. The male reproductive system has the testes, the vas deferens, the ejaculatory duct, and the urethra. There are also some accessory organs that contribute semen to the ejaculate. The urethra is common to the urinary and reproductive system in the male. In the urinary tract, the urethra becomes colonized with normal skin flora from the urethral opening. This can be both gram-positive and gram-negative bacteria. Urination flushes the bacteria out regularly, and the fact that the urine is usually slightly acidic also discourages bacterial growth. The remainder of the urinary system is considered sterile. In the female reproductive system, the vagina has a wide variety of normal flora. Hormones play a role as to what normal flora is present. At puberty, estrogen causes a glycogen-rich secretion to be developed. This supports the growth of lactobacilli, which comprises the majority of the vaginal flora in the menstruating female. This contributes to the acidity of the vagina and is protective. Pre-puberty and postmenopausal, there is a more neutral pH in the vagina. The normal flora changes over more to skin flora. This means that these individuals are more susceptible to vaginal infections. In the male reproductive system, the urethra is also part of the reproductive system, so the flora of the urethra would be the only flora we would find in the male reproductive system. Urinary tract infections occur mostly in women. The shorter urethra allows colonizing organisms a greater chance to enter the bladder. Usually the organism is a gram-negative bacillus, with most of the cases being E. coli. Catheterization increases the risk for urinary tract infections in both males and females. Urinary tract infections are ascending infections. They start out as urethritis, they move into the bladder and become cystitis, and if they go untreated, they may go on up into the kidney and become pyelonephritis. In males, the prostate encircles the urethra, and so prostatitis may be a complication of a urinary tract infection. The symptoms are dysuria, painful urination, with frequency and urgency. There may be a slight fever. Urinary tract infections tend to respond well to antibiotics. Prevention in females is to wipe from front to back so that you don't drag gram-negative organisms up toward the urethra. Also, after sex, you should try to urinate. This is particularly for the females because that helps flush organisms out of the area. Leptospirosis is a zoonosis caused by Leptospira interrogans. This is a spirochete. You'll remember these don't gram stain well, they're little coiled rods, but they can be demonstrated by dark field microscopy. Leptospirosis presents as an abrupt fever, myalgia, muscle stiffness, and headache. Myalgia is muscle pain. Rarely is the disease fatal. Mortality from this disease is due to kidney and liver failure, meningitis, or respiratory distress. The organism is shed in animal urine and may also be found in lakes or streams that might be contaminated with animal urine. It enters through tiny cuts in the skin. This disease is worldwide. It's seen in farmers and ranchers, in people who work around potentially contaminated water, or who may vacation and experience potentially contaminated water as part of their vacation outing. It responds well to antimicrobials, particularly penicillin. To prevent the disease, rodent control is important since most rodents carry this organism. Also, you want to avoid contaminated water. There is a vaccine for livestock and pets. Streptococcal acute glomerulonephritis is an antibody-antigen complex problem. Here, the antigen-antibody complexes from group A Streptococcus are not cleared from the blood. For some reason, these tend to collect in the glomerulus and the nephron, causing inflammation. As a result, urine output is obstructed, blood pressure increases, and there is a decrease in urine output. The urine that does leave the body tends to contain blood and protein. Younger patients tend to recover. Older patients may have permanent kidney damage as a result of this. Staphylococcal toxic shock syndrome is caused by a strain of Staphylococcus aureus that produces the toxic shock toxin. This toxin causes a sudden onset of fever, chills, vomiting, extremely low blood pressure because of body-wide vasodilation, and a severe red rash over the entire body. All patients who developed this syndrome were found to be carriers of the staphylococcal organism. There was a major outbreak in the 1980s that was linked to superabsorbent tampons. The tampon apparently was contaminated while it was being inserted. Because the tampons were superabsorbent, they stayed in place for a longer period of time. What made them superabsorbent actually increased the growth of Staphylococcus, and then it was in a warm, moist environment with lots of blood, so the organism grew in surprising numbers and produced large amounts of toxin. The organism may also grow in wounds, so it is possible for men and children to have this disease. We worry particularly about wounds that involve nasal surgery because a great many people are nasal carriers of Staphylococcus aureus. This is a life-threatening disease. If there is a foreign material that is embedded in the body, that needs to be removed, and then support measures need to be taken. Keep the blood pressure up, keep the fever down, those kinds of things. Superabsorbent tampons were removed from the market, but all tampon boxes carry a warning about using tampons and keeping them in place for too long. Individuals who use tampons, vaginal sponges, and diaphragms are most at risk for this disease, and so cleanliness and care in using them is critical. Bacterial vaginosis is a condition that is not an inflammation. Here we have bacteria infecting the vagina, but they're not inflaming the vagina. In many people, this is asymptomatic. There is a white discharge that has a fishy odor. For some reason that no one clearly understands, the lactobacilli that are normally found in the vagina are replaced with Gardnerella vaginalis and Mycoplasma hominis, two organisms that are not particularly pathogenic. We're unsure why the flora changes, but as a result, the pH goes above 4.5. This condition can be treated with antimicrobials, and we can do things to replace the lactobacilli. They can either use suppositories or encourage the patient to eat yogurt. Prevention is unclear, but people with bacterial vaginosis should refrain from sex and from douching. Vaginal Candidiasis is a yeast infection. It's caused by various species of the yeast Candida. It presents with severe vaginal itching and burning that is intensified by urination. Also, intercourse is quite painful. There may be a slight curd-like discharge. Candida is normal flora in the vagina in very small numbers. If there is an increase in vaginal pH, or if the bacterial flora is reduced, say as the result of antibiotic therapy, these organisms can grow to large numbers. The treatment is some sort of azole cream. Prevention is to maintain normal vaginal flora by avoiding excessive antibiotic use. Sexual activity exchanges microbes between partners. None of the organisms involved in sexually transmitted diseases will survive on cool, dry, inanimate objects. The only way these organisms are transmitted is through intimate sexual contact. The World Health Organization estimates that 333 million new cases of STDs occur worldwide each year. Half or more remain unreported. It's estimated that in the United States, 1 in 5 have a viral infection that's sexually transmitted, and that 25% of these are teenaged girls. About half of all sexual transmitted diseases affect people under the age of 25. In women, particularly young girls, PID is a complication, pelvic inflammatory disease. The organism spreads from the vagina through the uterus into the fallopian tubes and gets into the pelvic cavity. STDs are likely to be asymptomatic in young girls. That means that they don't seek treatment. The long-term consequences of untreated sexually transmitted diseases include birth defects in future children, ectopic pregnancies, miscarriages, sterility, and cervical cancer. Prevention for all sexually transmitted diseases include condom use. However, there is up to a 25% failure rate with condoms. Abstinence is the best policy, or monogamy, having only one sexual partner. There is some evidence that circumcision may reduce the transmission of disease from men to their partners. Gonorrhea is caused by Neisseria gonorrhoeae. This is a gram-negative coccus that is very fastidious. It is so fastidious that swabs are typically taken and cultured at bedside. This is sometimes called the clap, which comes from the French word clapoir, which means brothel. Males are usually symptomatic. They have pain in urination and discharge. This is why this is sometimes called the drip. It can cause prostatitis, epididymitis, and sterility. Females are usually asymptomatic. They may have PID, but usually they don't know that they've had gonorrhea until they discover that they're sterile or there's some problem with a pregnancy. Gonorrhea occurs only in humans. It can be transmitted to the infant in the birth canal. It causes ophthalmia neonatorum, which can cause blindness. Treatment is antibiotics, but there are a number of resistant strains, so dual therapy is usually recommended, a broad-spectrum antibiotic and something more specific for gonorrhea. There is no long-term immunity that is acquired from having this disease, so once you've had it, you can continue to have it. Syphilis is caused by Treponema pallidum. This is a spirochete. This particular organism is capable of penetrating intact skin. We've been unsuccessful at getting it to grow on artificial media, and humans are the only host. There are 4 stages to the disease of syphilis. During the primary stage, there is a small, painless chancre sore at the site of penetration. This will show in 10 to 21 days after exposure and will last from 3 to 6 weeks. It often goes unnoticed because it is painless and frequently it's on internal genitalia. In the secondary stage, there's sore throat, headache, mild fever, and a widespread rash. This stage of the disease has sometimes been called the Great Pretender because it looks like a number of other diseases. The rash may last for several months. During the latent phase, there are no symptoms of the disease. This stage can last a decade or longer. During this stage, the organism has found some organ in the body and it's taken up housekeeping. It's doing damage while we're in the latent phase. The tertiary phase occurs years later. Untreated patients suffer the consequences of the organism settling in an organ. They may have brain damage, heart damage, spinal cord damage, kidney damage. It just depends upon where the organism landed. Gummas are rubbery, swollen lesions in the affected organ. This is sometimes the tip-off that the problem is syphilitic. Syphilis can be transmitted to the fetus. This is known as congenital syphilis, and it causes severe birth defects. The treatment is penicillin. Chlamydial infections are caused by Chlamydia trachomatis. This is an obligate intracellular parasite and the most common sexually transmitted disease in the United States. It causes 2 diseases, lymphogranuloma venereum and trachoma. Now, most cases of chlamydia are asymptomatic in women, but symptomatic in men. In men, it gives some of the same symptoms as gonorrhea. This organism also has a high incidence of going deeper into the male reproductive system and causing epididymitis and orchitis, inflammation of the testes. Babies can become infected at birth. This gets in their eyes and they have a disease called trachoma. Trachoma is the leading cause of non-traumatic blindness worldwide. We see it more in underdeveloped countries because in this country it tends to get treated. Lymphogranuloma venereum is the most severe form of chlamydial disease. Here there is a genital lesion at the site of the infection. The organism then travels to the lymph nodes where a bubo forms. You'll remember that a bubo is a painful, swollen lymph node. This may actually rupture and drain pus. Treatment is doxycycline or erythromycin. Infants who are born to mothers with chlamydia can get a cream for their eyes. Chancroid is caused by Haemophilus ducreyi. This is a small gram-negative coccobacillus that is also an obligate parasite. Here there is a soft, painful genital ulcer. This is called a soft chancre. Men typically get one sore, women get 4 or more. Because women get so many, this may block the urethra and lead to painful urination. This disease is fairly rare in America and Europe, but it's more prevalent in Africa, Asia, and the Caribbean. This can be a little souvenir you bring home from your vacation. Buboes may also occur with this particular disease. The organism responds well to antibiotics. Viral sexually transmitted diseases include genital herpes and genital warts. Genital herpes is caused by human herpes virus type 2, which is a DNA virus. There are painful fluid-filled lesions on the genitals. This is a latent virus that lives on the splanchnic nerves, the nerves that feed the pelvic area. The virus may be shed when the individual is asymptomatic. Infants can acquire this disease in the birth canal, and serious deformity or death may occur. Acyclovir will help heal the lesions and lengthen the remissions, but there is no cure for genital herpes. Genital warts is caused by the human papillomavirus, a DNA virus. The warts may be small bumps to giant cauliflower-like growths that are known as condylomata acuminata. While the warts can be removed surgically, by freezing, by burning, by laser, they frequently return. Removing the warts by laser has a certain danger to it. The virus becomes aerosolized and can be inhaled. Also, genital warts is related to cervical cancer. Women should regularly get pap smears looking for abnormal cells on the cervix. Depending upon the stage of the cancer, the cervix may be removed or the entire uterus may be removed as part of the treatment. There is one protozoan that causes a sexually transmitted disease, and that is Trichomonas vaginalis. This is a flagellated protozoa. This disease is usually symptomatic in women and asymptomatic in men. Women will notice a yellowish-green vaginal discharge and vaginal irritation. Men may have an inflammation of the urethra or the prostate, but that's relatively rare. Infants can pick up the protozoa in the birth canal. Treatment is a single dose of metronidazole, and moms can be treated before they give birth to prevent infants from getting it.